You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, who's a candidate for mini dental implants? If you are missing teeth, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Larry Stroud. Dr. Stroud is the founder of Smile Studio at Valley Dental in Louisville, Kentucky. We've invited Dr. Stroud on the program today to discuss who's a candidate for mini dental implants. Dr. Stroud, welcome to the program.
Thanks, Randy. It's a pleasure to be here.
Mini implants. This seems to be your focus. I mean, you're the go-to guy in Louisville, I've been told, for mini implants. Is that right? I mean, has it become very popular?
It's become popular, and it's become even more popular, Randy. Through the years in my practice, I've seen people that have struggled so hard with their dentures, especially lower dentures. They can't wear them. They can't keep the things in. They can't eat. They rub. They hurt. People with partial plates, they don't like those unsightly clasps. And over the years, their only real good solution for that in the past was the traditional surgical implants.
Okay.
And that's a good option. That works. But a lot of people I've found really don't want to go through all the extensive surgery involved.
Is it a lot more surgery than a mini implant?
Yes, it is. It's a lot more traditional surgery. Typically, patients are put to sleep, and it's a big surgical process.
Do mini implants work, for the most part, as well as a regular dental implant?
Yes, the research and statistics we have, and based on my practice, about a 95% or so success rate. And yes, they definitely do work. We're doing it for a lot of people, and there are over 1,000 dentists that we know of right now that are doing these things across the country.
Yeah, I mean, our show airs nationwide, and we've talked about mini implants on the show, and it seems to be a very popular topic. People, I guess, get their teeth back. How long have, or how did you get involved in mini implants? Why the big focus?
Well, I got involved with mini implants about 5 years ago. I had just seen some literature, been reading some literature about it. I never placed traditional implants, never really wanted to. It is a lot that the patients go through, and it just looked very interesting, these mini implants, because it looked like a way that patients could have this sort of thing done without having to go through so much.
And they are less expensive, I guess, than regular dental implants. Is that right?
Yeah, significant less cost than the traditional implants. And a lot less healing or recovery time. It goes very quickly with the mini implants.
So what are the different categories of patients? What type of patients are you seeing that are coming in for mini implants?
People that are missing one tooth, people that are wearing partials and hate those partials, and we can replace several of the teeth or all the teeth that are on their partial plate, even teeth in the front. People that are wearing dentures and they're uncomfortable and irritating and rub and sore. Even teenagers that are missing some front teeth that just do not form or do not develop.
So in the front, not a problem?
Right. Can be done in the front.
How old do you have to be to get a dental implant?
We have done these mini dental implants on patients from age 15 to 88.
How big of a problem is tooth loss?
Well, it's a big problem. I mean, there's probably over 40 million people that are that have lost their teeth.
That are wearing dentures, is that right?
That are wearing dentures, and that usually starts with losing one tooth.
Yeah, we talked on the phone, and one of the things you said is that if you got them early enough, that you could probably stop that snowball effect from happening. How so?
Well, if a person is missing one or two teeth, if they have those teeth replaced pretty soon and supports the other teeth, it will just help from the deterioration of the other teeth and maybe kind of stop the downhill process.
Okay, let's compare dental implants, and starting with the one tooth. How does what you do differ from what traditional dentistry would offer to fix that one tooth?
Well, in the past what we did, and we did this all the time too, if a person's missing a tooth, one tooth, to do a traditional type of bridge, you have to trim or grind down the teeth beside that to put a bridge in. With mini implants now, we can just put an implant in, put the tooth on it. The good teeth stay intact. You don't have to grind them down, and so it's just a lot less invasive and not destructive to the other teeth.
So the mini implant, by the way, for people that don't know what that is, I mean, what is it, a tooth root? I mean, it mimics a tooth root. What is it?
The mini implant really looks like a long screw.
Okay.
It really just looks like she came in one visit. We put in about 10 or 12 of these mini implants, okay, in all different areas of the back part of her mouth. In one visit, we put the implants in. She came back about 3 weeks later. We put the crowns or the teeth on them, and she left that day with just all her teeth just staying in. She was done with those partials, could throw those partials away, and she just loves her new teeth.
Well, she looks very happy. That's
she
for
loves
sure.
her new teeth. She even wrote me a letter, and she said, I never even had to take a pain pill. So, you know, that was a little unusual, having 10 implants in, but that's what she told me. So it went real nice for her. And Randy, and if anyone has any questions, if they'll just call our office, we're happy to see them. We do a free consultation. Just talk to them like you and I are talking now,
Okay.
just to see if they're a candidate, or if they just want some information. Lisa and Nikki in the office both know everything about this. They can call and find out whatever they need to know, and we'll go from there.
All right. Thank you for coming on the show. Very interesting. Very good.
Thank you,
Very
Randy.
good.
Thanks for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a loved one, visit our website at wellnesshour.com. For now, I wish you good health.